Hello, today's lecture about schizophrenia.
Schizophrenia is a chronic disorder of unknown etiology characterized by disturbance in cognition, emotion, perception, thinking, and behavior. A worldwide, 2 million new cases appear each year. Lifetime prevalence of the disease is about 1%, which mean that 1 in every 100 persons will develop schizophrenic disorder. Symptoms of schizophrenia. There are negative and positive symptoms. Negative symptoms refer to what is abnormally lacking or absent in the person with a psychotic disorder. Include flat affect, anhedonia, eulogia, avolition, diminished activity of daily living. Positive symptoms of schizophrenia represent additional behaviors not generally seen in people without the condition. They include delusions, hallucinations, disorganized thinking, and abnormal body movements. Diagnostic criteria of schizophrenia. Schizophrenia is disorder whose diagnosis is based on observation and description of the patient. There must be at least 2 of the positive signs and symptoms must be present for at least 1 month. Or negative symptoms present at least 6 months for the disorder to be confirmed. Schizophrenia is a mental illness whose symptoms usually occur in phases. Phase number 1, the schizoid personality phase. Individuals in this phase described as indifferent to social relationships and having a very limited range of emotional experience and expression. Described as lunars. Phase 2, the prodromal phase. Characteristics of this phase include social withdrawal, impairment in role functioning, and neglect of personal hygiene and grooming. The length of this phase is highly variable and may last for many years. Phase number 3, schizophrenia, or active phase. In the active phase of the disorder, psychotic symptoms are prominent. Delusions, hallucinations, disorganized speech begin to appear beside negative symptoms. Phase number 4, residual phase. A residual phase usually follows an active phase of the illness. Symptoms during the residual phase are similar to those of the prodromal phase, with flat affect and impairment in role functioning being prominent. Etiology of schizophrenia. The current consensus is that the etiology of schizophrenia is multifactorial. So, we can divide it to the following causes. Biological influence, which including genetics and twin studies. The siblings or offspring of an identified client have a 5 to 10% risk of developing schizophrenia. Moreover, the rate of schizophrenia among monozygotic, identical, twins is 4 times that of dyszygotic twins. Biochemical influences. There is evidence of significant biochemicals as excess of dopamine-dependent neuronal activity in the brain in the 4 major dopaminergic pathways. Physiological influences. Viral infection and physical conditions as birth trauma, head injury in adulthood, alcohol abuse, and cerebral tumor are thought to play a part in causing schizophrenia. Psychological influences, including relationships with members in the family. And environmental influences, including sociocultural factors and stressful life events, all have an important role in causing brain chemical disturbances leading to schizophrenia. Types of schizophrenia. The following types are according DSM-4 of psychiatric disorders, including disorganized schizophrenia, is also called hebephrenic schizophrenia. This subtype of schizophrenia is characterized by symptoms that interrupt a person's thinking and communication which considered disorganized symptoms. It usually occur before age 25 years. Catatonic schizophrenia. Catatonic schizophrenia is characterized by marked abnormalities in motor behavior as catatonic stupor, mutism, which means absence of speech, negativism, and waxy flexibility may be exhibited. Paranoid schizophrenia. Paranoid schizophrenia is characterized mainly by the presence of delusions of persecution or grandeur and auditory hallucinations related to a single them. The individual is often tense, suspicious, and guarded, and may be argumentative, hostile, and aggressive. Residual schizophrenia. This diagnostic category is used when the individual has a history of at least 1 previous episode of schizophrenia with prominent psychotic symptoms. How to treat schizophrenia? Schizophrenia requires lifelong treatment, even when symptoms have subsided. Firstly, we have to gain patient compliance and the trust in psychiatric team treating him. Treatment with medications and psychosocial therapy can help manage the condition. In some cases, hospitalization may be needed. That's enough for today. For any question, please leave a comment. Bye.